Gentle disclaimer to all of our listeners. All medical information mentioned in this podcast is purely informational. It is not individualized medical advice. Please follow up with your physician or medical practitioner for individualized care specific to your needs. Thank you. Welcome everyone to the Know and Do Better podcast. My name is Dr. Melanie Carminati, and I'm very excited for us to be having a conversation today with Jodi Taub. She is a licensed clinical social worker. We are in for a treat, all of us who are listeners and have listened to this podcast on the very topics. Today, we'll be talking about coping with chronic illness. So, Jodi, thank you so much for joining me today for this conversation.
Thanks, Melanie, for having me here today.
A bit of background about Jodi for those who are unfamiliar. Jodi has more than 27 years of extensive clinical experience. She treats a wide range of mental health, emotional, and relationship issues. She's had the opportunity to work with children and families, as well as adults and couples. She's trained in acceptance commitment therapy, cognitive behavioral therapy, mindfulness-based cognitive therapy, mindfulness-based stress reduction, and she treats mood disorders, OCD, ADHD, anxiety, and depression. She's also trauma-informed and has been extensively trained in acute, chronic, and complex trauma, as well as PTSD, grief, and loss. She's also a chronic illness and rare disease and medical trauma expert, which is what we'll be talking about specifically today. Managing mental health can be just as important as managing your physical health. And so talk therapy can be an effective way to manage these interpersonal relationships, establish coping strategies, and coping with the challenges of managing complex healthcare conditions. So Jodi, thank you again for being here. Wanted to just reference this quote that I found from the CDC that states that 6 in 10 Americans have a chronic illness, with 4 in 10 having more than 2 chronic illnesses. That's more than half the population that has illness that is long duration and it requires medical care, whether or not it's preventable or not. And I believe that when the majority of people think about chronic illness, they think about physical and biological impacts. But I'm hoping that you can help us shine a light on today with our conversation about the significant impacts on mental health and the unique challenges individuals with chronic illness face. So, Jodi, can you tell us about your journey and how you ended up in the work that you're in?
I really liked that you brought up those stats because I think so many of us living with chronic healthcare conditions, and I say living with chronic healthcare conditions because one of the things we didn't talk a little bit about in the bio is that I'm a patient. And so I come to this podcast today, not only with my mental health professional hat on, but also as a patient with lived experience. And there are so many of us who do live with chronic healthcare conditions, but I do think it's one of the aspects of society that many of us don't talk about. And there's people who may be listening to this podcast who, are very forthright and they're out about their chronic illness. And some people choose to not talk about it or reveal that to other people. And so that adds another layer. But I've lived with chronic healthcare conditions my whole life. 17 years ago, I was diagnosed with primary immunodeficiency disease, which means that I'm immunocompromised. My body does not make the antibodies necessary to fight off bacteria and infection. And as a result, I have 30 different healthcare conditions because it impacts all of the systems of my body. And so at the time when I was diagnosed, and this is pre-social media and pre-online work, I was working as a school social worker, and I needed to pivot into private practice in order to be able to attend my doctor's appointments and my bi-monthly infusions. And so since this time, I have been working with patients, families, and caregivers who live with a variety of chronic healthcare conditions. I'm an expert lecturer, and I write a writing series on coping with chronic illness and rare disease. I've been doing that for the last 3 years. And I'm in the process of writing a book, and my book will be complete. I have to hand it in to my editor on May the 31st about coping with chronic illness and rare disease.
Wow, amazing. Congratulations on the book.
Thank you.
Thank you for giving us that background on your own personal experience. I think it really changes how you view things and how you go about things. And I'm sure that the patients and clients that you work with relate to you on that level. I know as a physical therapist, because at Inspira, we see a large volume of people who have EDS, different hypermobility, endometriosis, chronic pain. And we, as physical therapists, we are aware first of the physical impairments and how that impacts their activities of daily living. But living with chronic illness obviously impacts, or not obviously, impacts mental health as well. Can you talk about how chronic illness can impact mental health, mood, and relationships?
Absolutely. The intersection between chronic illness and mental health, I think, is vital and important to recognize, because for people who live with chronic healthcare conditions, your healthcare condition will influence all different aspects of your life, and that can affect your mental health, both in a positive way and also at times in a negative way. So I like to think about chronic illness as like, kind of your long underwear. It's like you're wearing it underneath. It's a part of people might see your outside clothing, and that's what you're wearing during the day, but you have your long underwear on underneath. And it's a way that I describe how people who live with chronic healthcare conditions, that it's always with you. It's a part of who you are. It's a part of what you do, the choices that you make, and it influences all aspects of our lives. It influences our time, the way that we approach every day, our routines, how we engage in the world, how we are able to get in and out of a chair, how we're able to go to work or not go to work. It influences our relationships. Many of us who live with chronic healthcare conditions have caregivers. We have identified people who may pick us up from a surgical procedure or a doctor's appointment, or may pitch in and watch our kids or pick them up from school or walk a dog when we're not able to do so ourselves. And that community is important. Living with a chronic illness also impacts our identity. And depending on where you are in the journey, whether you were recently diagnosed and you're having to come to terms with what that might mean for you and your future and the choices you've made, or if you're someone who's lived with a chronic healthcare condition for a period of time, but all of a sudden you have a new flare and you have a new healthcare condition, or you lose ability in some way because of a new flare or an illness that happens, or just your everyday life stressors that all of us go through, such as divorce or a move or a new job. Everything is impacted by the way in which we manage our illness. And for those of you listening, I know this is not foreign to anybody, but our energy levels. Many of the people listening to this podcast deal with chronic fatigue, and able-bodied individuals do, have a hard time understanding what that means, that like we only have so much gas in the tank, and we only have so much fuel to utilize. There's a theory called spoon theory that a woman came up with to describe, for at the time, people who were living with lupus, but it's a way for patients who live with chronic healthcare conditions to describe and give a language to other people that we only have a limited amount of spoons. So if we have 8 spoons that day and we use 2 to get ready in the morning, 3 to get to work, 4 to get through the rest of the day, then we're done at the end of the day and there's nothing left. So it's really important that all of us learn how to manage our mental health, because managing your mental health makes managing your physical health easier. If you're in a place where you can cope with how to live with your everyday boundaries, expectations, your relationship, it allows you to be more flexible in dealing with and managing all that comes with managing your physical health care.
I mean, you just touched on so many points there. The first thing that stuck out to me was, the identity, right? And the grief that many people who have chronic illness, I'm sure they talk to you about and you work on with them, because I can only, support and imagine those people who are going through it, that whether it was something that they were born with or something that, started after birth, maybe teenage, maybe adulthood, whatever it is, the grief that goes along with, the shifting identity of someone who has chronic illness. So I just want to point that out, because that was like a really strong point that I noticed from what you said. And then for myself as a physical therapist, when I'm seeing the patients, they mention it's just overwhelming. You talk about the energy level fatigue as a common symptom that our patients have, and the management and the coping and the different strategies that they have for themselves is what they need, and they really lean on to get themselves through the day, through the week, so that they can live that fulfilling life. Many, many important points that you touched on. I just wanted to emphasize again. So we talked about identity, and I just mentioned grief. Are there some other common emotions and feelings that you encounter a lot with your patients who are dealing with chronic illnesses?
Yes, I think that there's a lot of different emotions and feelings that come from all of this. And I wanted to touch on one piece when you were talking about grief and loss and identity. Is, I had a patient who has EDS and was a dancer. That was a part of their identity. And now the EDS does not allow them to be able to move and dance in the same way. And so when we're looking at, loss and grief, sometimes it's our illnesses steal a piece of who we are, a piece, because some of those identities are tied to our physical capabilities. And that's something we talk quite a bit about, is the grief and loss around that. And also, it's not uncommon for patients to have experienced anxiety and depression. Many patients have experienced medical trauma if you've had a serious or life-threatening illness or disease, and the ramifications of what happens with that. A lot of patients have experienced PTSD. You may have had an experience where you had an acute physical episode and it impacted you, and you may go along for a period of time, and then all of a sudden it's like, oh wait, hold on, like there goes my hip again. And you had been in a good place for a long time, and then it brings back all of those feelings again, and saying, oh gosh, now I have to go through this whole process all over again. And so it's very challenging. And one of the things I talk about quite a bit is that grief is not linear, and it is not linear for people who live with chronic healthcare conditions, because you live with your chronic healthcare condition, and depending on what happens, it's more of a roller coaster. We sort of go through ups and downs with our flares, and that can cause emotions. And so trying to find ways to ground yourself throughout that process. But it's not uncommon for patients who live with chronic healthcare conditions to deal with mental health issues. This is not your fault. Anybody who would be living with a chronic healthcare condition would face a mental health condition at some point. It's not fun to experience human suffering and pain. And that is what living with a chronic healthcare condition is like. And then on top of that, we have to deal with judgment from other people, and managing our insurance, and managing our doctor's appointments, and all of those relationships. So it's a lot. So if you are experiencing anxiety and depression, or you've experienced clinical mental health care symptoms because of your chronic illness, well, of course, you're human. But the goal is to find a way that they are more tolerable and that they are manageable, because there are going to be times where we have different mental health flares, and there's times where things are a little bit more smooth, and learning those coping strategies, learning how to communicate within your relationships is vital.
Thank you for that. I explain to my patients who have persistent pain, persistent chronic pain, that if you imagine, being in pain and having that chronic pain being like a building with the fire alarm always going off, don't you think that you're going to be a little challenged with emotions, or just stressed or anxious or all of that? So it only makes sense. I wanted to talk about some fear avoidance behavior that we encounter with patients who have hypermobility and who have persistent chronic pain. Many times, if there's been some injury that occurred with a certain movement or a certain exercise, fear develops around that. So as a physical therapist, we do coaching gradually with a protocol that's central nervous system based and movement science based to eventually reintroduce that movement. But that's what we see from a physical perspective for physical therapists, are there some other fears, specific fears or common fears that people living with chronic illness encounter?
Yes, you brought up a important point of dealing with fear avoidance and how you can get people to utilize exposure therapy, which is what you're doing, to feel safe, to reintroduce movement in a way that feels emotionally safe and stable for them. Um, what often comes up, probably more so than anything else, is the fear around how chronic healthcare conditions impact safety and relationships.
Mhm.
So, put in the safety bucket, how am I going to support myself? How am I going to maintain my health insurance? What happens if I get a denial? So, there's a lot of fears around just being able to live and feel that you're getting your basic needs met. So, and those fears are real because many people have experienced denials from insurance claims,
Sure.
and fear of financial instability because it is not cheap to live with a chronic healthcare condition. So those are a lot of fears that people have. And also the other big camp is in relationships. So will I ever meet a partner? Will my partner leave me because I'm limited in what I can offer to somebody? Fear of losing friendships and relationships is a really common fear. And so that's the work that I do, is to help people to bridge and build um, those relationships and find support with the people who are available and willing to do so.
Right. And I know that acceptance commitment therapy is one of the treatment approaches that you use. How do you guide individuals through acceptance of a chronic illness?
So I think if we look at acceptance, it's a continuum, right? It's a process for everyone because there are some people who are in different stages of their chronic healthcare conditions. This is probably not unknown to the people who are listening, but most people with chronic healthcare conditions end up having other chronic healthcare conditions. And then over time, there might be a new diagnosis. So acceptance becomes a process, and the new normal can be changing. Just as I was speaking about before. So, I think it's important for patients in my work with acceptance is accepting the moment, learning how to use mindfulness strategies to ground yourself in where you are. And I think some of the strategies that I really help to employ with my patients are making sure that you have your non-negotiable routines that you need to do every day.
Mhm.
We know that routines are important for brain integration and for mental health stability. So making sure, and so that may be different for everybody. Maybe your routine that day is to make sure that you get some movement per day. You are able to brush your teeth and do basic hygiene. You're able to take your medications that you need to do per day, that you make sure that those things are taken care of. And then the other piece of also acceptance is learning how to navigate community support. How do I communicate to my friends and loved ones about what I need and my changing needs and what those boundaries and expectations look like, so that you're not in a position where you're continually feeling, which I'm sure many of you have been through, this like shame guilt cycle or resentment cycle where you have a particular friend or family member who will ask you to do something, you explain that you can't do it, but then they ask you to do it again. So in learning how to talk to people about, hey, what I term inconsistent capabilities. So there are some days that I can do certain things, and there's other days that I just can't. And so what would work best for me is if we can check in the morning. And so, if you're open to being flexible, maybe we can get together that day. But there's a chance that I might not be able to. And so learning how to find a way to express what you need to your community support. And that acceptance, when you learn to accept that you have some limitations, but there's always a modification, is part of accepting this is what I live with. This is how I need to live. And I need the people around me to learn more about what I need so that we're not at a crossroads where they're asking me to do something I can't do. I feel guilty and I feel resentful because I've told them once or twice and they asked me again. So it's bridging that gap. And then another powerful piece of acceptance, I believe, is empowerment to advocate for yourself. And so that empowerment may come from like educating others and telling people, wow, these are all the things I learned. These are the skills that I've had. I've learned how to navigate a very complicated medical system. I've become an expert in my disease. So there are skill sets that you've learned along the way, and it's important to communicate that to other people. And the last part is that, living with chronic healthcare conditions doesn't mean that we're just doomed to trauma and to anxiety and depression. There is resilience and post-traumatic growth that comes from that. All of us have learned how to thrive, and we learn how to thrive and survive. And there are lessons to be learned from that, and to remind yourself of that, and to remind others of all the work that you do just to get through your day.
I love that. I feel like that's not spoken about enough. The resilience and the post-traumatic growth, I think you said, right?
Yes. Mm-hmm.
Right. Yeah, that's not said enough. And so I'm glad that you're saying that. And I feel like the acceptance part that you're talking about leans into self-advocacy. And how do you work with patients and clients specific for self-advocacy in medical settings? Because I imagine not only explaining themselves to family members and friends, but then also being able to advocate in a medical setting. How do you work with clients regarding that?
That's right. It's actually a topic that comes up probably the most, because that relationship that you have with your healthcare providers is going to guide your life. And that is the truth. And all of us know that. And you are, we both are healthcare providers. So, and building trusted relationships with the people who are taking care of you is vital. And that's about finding the right fit, finding the right person who's willing and wants to work with you and meets your needs. And then also within that trusted relationship, being able to feel that you can advocate for yourself. So because it is a mutual relationship. There are times where you might say to your physician, you know what? I've had a lot on my medical burnout plate. I've had a lot of appointments recently, and I just don't feel ready to pursue dealing with this part of my chronic healthcare condition. So it might be, might even just be going to the dentist. I'm putting off dealing with my teeth right now because I've had so many appointments and I've had a lot of physical therapy recently and I'm feeling medically burned out. Mm-hmm. Or talking to your physician about when things don't go right and how to maneuver that conversation to say, this happened, but I really feel like I'd like to try a different medication, or I want to take this into a different direction. So I think that advocacy is important. One thing that comes to mind for me, I work with a lot of patients who are immunocompromised who wear masks, and now masking, is not mandated in healthcare settings, and a lot of immunocompromised patients have to say, hey, by the way, I really need you to wear a mask. And this is important. And that conversation of advocacy of like telling the person, hey, I need you to do this to keep me safe. I think it's an ongoing discussion because those relationships are important. And there's many patients, especially, who you may have some of the healthcare conditions that Melanie, you talked about earlier, and it may have been a long road to the diagnoses. And, you may have experienced medical gaslighting. And so that puts us on the defensive, right? Like, especially when we go into a new provider and we're telling them, oh, I have POTS or hypermobility or EDS, and you don't know how familiar they are with the disease, how it impacts you. And so often we are the people who end up educating our healthcare providers and letting them know this is how it works for me. So self-advocacy is really important in navigating the medical and physical space.
Now, earlier you mentioned some coping and grounding techniques. Could you give us more details about those?
Sure. In starting to talk about coping skills and strategies, there is no one size fits all. Everybody has different abilities, and everybody has different strategies that may or may not work for them. So I've always been of the camp, if you don't like something, don't do it. Try something that works for you. And often in our pop psychology culture, we'll pick up a certain technique, and then everyone's utilizing that technique, and it doesn't mean it works for everybody. But there are some tried and true things that we know are important in learning how to cope. So one would be making sure that you get out into nature. So like go outside, walk outside, get out your door in New York City, and especially I know for many of us who deal with chronic fatigue, it's easy to say, like it's so hard. I don't feel well, but sometimes we have to do little things and a little push. Each day. And it may not be all of these things. Mindfulness and meditation techniques are great. Listening to music can be really soothing for people. Physical touch. So, for those of you who have pets, we know the power of all of the feel good dopamine chemicals that we get from like hugging our animals or, hugging a friend or, or your partner. Creative expression. And what I always say, especially for people who have, mobility issues or are at home, we have access. This is one of the beauties of being online is that we have the world at our fingertips. And so you might be able to it may be that, you're creative in crafting, or maybe for you, your creativity is like joining a book club or reading about a country that you're really interested in and wanted to visit. I also think it's important to maintain routine. We know this, and we learned a lot about it from COVID of what happens when we upend our routines. Our brain likes familiarity, and it's important to integrate something that we do every day, a little bit of time for ourselves. And it doesn't have to be big. Sometimes I'll hear people say, "Well, I don't have time. Like I'm going to all my appointments, and I'm exhausted. And I'm just trying to keep up. Everything just feels so overwhelming." And so if you ask somebody and then say, oh, well, then, you're asking me to put a coping strategy on top of all of that. But the truth is that those utilizing maybe 15 minutes out of your day or maybe a half hour increment in your day can then provide the flexibility you need that opens up the door. I also think it's important for people to utilize community support. Those are really important coping strategies. There's a lot of support out there. There's online support groups that you can be anywhere from all over the world, and you can join either a peer-led support group, a therapist-led support group. There's a lot of Facebook groups. I know many of you, I'm sure, have seen online where you can just pop in as you may and connect with other people who have your healthcare conditions from all over the world. And then lastly, community support. It's really important that you maintain your relationships with other people. One of the things I hear the most is how disconnected people often feel from their able-bodied loved ones because they feel like they don't understand or they don't have time. And you've got to bridge that gap. We can't expect other people to understand what it's like to live with healthcare conditions, but they don't need to. What they do need to do is be able to learn from you how they can engage with you and how they can be supportive. And that can be small things. So it might be dropping a text to somebody. It may be, setting up a Zoom call or a phone call if you're not open to seeing somebody and you're just too tired to meet them in person. But it's really important to stay connected to people, because living with a chronic healthcare condition is isolating. It feels isolating to live in a body that does not match your mind and how you feel. And the purpose of living is connection to other people. And
Mhm.
so there's always a way to do that, even not even, even if you have the opportunity, you can meet people in person. But if you don't even need to leave your home to do that. Um, and then lastly, small things you can do is also breathing. So to slow your breathing down if you're having an anxiety response, a fight or flight response, to do slow box breathing, which is counting from
Mhm.
5, 4, 3, 2, 1. Those are some grounding techniques. There's also the butterfly hug. If people could see me, where you
Mhm.
cross your arms across your shoulders and sort of hold on. It can stimulate the vagus nerve, which is
Mhm.
a calming mechanism. So there's lots of different strategies that you can use, and it's learning how to employ them at the right time and in the right place.
I love that butterfly hug. I haven't seen that one yet. That's nice, and that's a quick and easy thing. And it's a self love moment too when you're giving yourself that hug. Um, what role do apps play? Because there's so many apps out nowadays for all different things. Are there particular apps that you recommend to your clients? What do you think?
So, yes, there's a ton of mood tracking apps out there. And as far as mental health goes, I like a lot of my patients like Daylio, Daylio, and there's another one called Mood Panda. And what you can do is similar to tracking your physical symptoms, you can track your mental health symptoms. And so, sometimes what we don't realize is that, we're kind of going along and, with our everyday experience, and we don't realize, wow, there's no big stressor that's happening right now, but it's a series of small stressors over time which have been impacting my mood. And by using some of the mood trackers, it allows you to recognize, oh, wait a second, I realize that, you know Mondays and Fridays tend to be really hard days for me. Or I realize that, like, wow, I'm really being impacted by this recent flare, and I probably should check in with my therapist, or I should employ some of these strategies or make a plan with a friend, because I realize that my mood's been a little bit low.
Mhm. Okay. And in regards to like any research that's out there that you thought is really relevant to the population that we're talking about, people dealing with chronic illnesses, what what do you have to share?
Yeah. So research has shown that living with chronic healthcare condition is one of the greatest factors contributing to loneliness.
Mm.
And we know that loneliness then can contribute to poor healthcare outcomes. So improving our mental health and increasing our ability to maintain close relationships and support decreases isolation and loneliness, and it improves healthcare outcomes. So what we really want to do is, and I highlight this again as I was talking about earlier, is the research has shown that social connections are vital for us. And so we need to make it a priority, just as we do managing our physical health care conditions.
I think it's so important because, as you said, it can be very isolating when you're going through those experiences. And I know uh, from my patients and friends and family who have different, are living with different chronic conditions, sometimes they keep it all to themselves and it's years before they even mention it to me or mention it to anyone or mention it to a doctor. So a lot of it is just normalized, unfortunately, but um, really important to be connecting with people. And loneliness is something I know that everyone was dealing with too during COVID. So I can only imagine how that kind of amplified things for those living with chronic illnesses as well. So, Jodi, this was an amazing conversation. I learned a lot myself. Do you have any final words of encouragement that you want to share with the listeners?
You're not alone.
Hmm.
So continue to reach out to others. We're a large community of people, and just how Melanie mentioned before, half of our population is living with chronic healthcare conditions. And the more openly we live, the better off we are.
Thank you.
Thank you so much. And thank you to all of our listeners. Stay tuned for another informative chat. Thank you, Jodi, again.
Thanks, Melanie.